As soon as you discover you are pregnant, book your first prenatal appointment with your doctor or midwife. In your first appointment, your detailed history will be taken, like your last day of your periods, length of your menstrual cycle, any significant gynecological history, medical history, family history of concern, your daily lifestyle will be asked, any medication you are taking. Your healthcare provider may examine you, your weight, height and BMI will be calculated. Your pulse and blood pressure will be checked. Your due date will be calculated. It will be the date when you are 40 weeks pregnant and your baby is fully mature to come out. This date is calculated by adding 9 months and 7 days to your last periods. The more accurate estimation of the due date is from your first trimester ultrasound. Your healthcare provider will also order some blood tests as checking your blood group. This is done to know what type of a blood group you have and to know whether you are Rh negative or Rh positive. Rh is a specific protein present on red blood cells. You will need special care if your blood group is Rh negative and your baby is Rh positive. Measuring your hemoglobin. Hemoglobin is made of iron-rich protein which is present in red blood cells. Red blood cells are special cells which carry oxygen from lungs to whole body. Low hemoglobin indicates anemia. You need to have good amount of hemoglobin in pregnancy to meet the increased demands of pregnancy. Checking immunity against infections like rubella and chickenpox. This is done to make sure you are protected from these infections in your pregnancy. Checking for other infections like hepatitis B, hepatitis C, syphilis and HIV. This is done to detect whether you are carrying any of these infections. If so, your antenatal care will be altered accordingly. Checking your urine. You have to give urine sample at each visit. It will be checked to rule out any infections. Your midwife or doctor will also discuss with you the importance of healthy diet and nutrition in pregnancy and will also advise you about screening tests for the baby. You can discuss with your doctor about common discomforts you are having, like your troublesome symptoms like nausea, vomiting, constipation, or any other issues if you are facing.